In India, the use of information and communication technology in the industry of health is very less because the services are lagging because of the lagging of the services it's, the people are not paying their attention towards the information and communication technologies. Yes, and also old prescriptions in the old in the common people keep all the old prescriptions, X-ray reports, in the same archive. This was done 20 years ago, and it's done now also. Even though India is advanced in technology, once the world is advanced in technology, and India has access to these technologies, so India should have improved at least a little bit by storing some information in the form of mm, a, e-records. But there has been a little improvement, but there has not been a major improvements. So the National E-Health Authority is proposed to be set up by the Government of India as a promotional, regulatory, standard setting organization to guide and support India's journey in e-health. It will also be the subsequent realization of ICT benefits in the health sector. It will also set up and it will be set up under the government's Digital India program. The Digital India program aims in digitalization of the whole of India. So this will be set up under the Digital India program and will work towards the integration of multiple health IT systems in a way that it ensures security and privacy of data and it abides by the constitutional laws. So the National E-Health Authorities will be set up as a health information network where various stakeholders and contributors both contribute to the health information, and they'll set up a repository of information. They'll also be allowed to communicate with each other using the application programming interface API. This is also used in many smartphones. So the government is using the private technology, but still this is a very major improvement. This will function the same way as many mobile applications and other devices do so, as I already said, smartphones. Healthcare APIs will allow the doctor to communicate with chemists and testing labs and centers to communicate with the hospital's database. And this will also like for example, in a smartphone, you get notifications when a person sends a message. So using on the same basis, you can get reminders of reminders to mothers to give the vaccination to children, or reminders for a person to take his medication at that time, or an alert that they are going towards going to out of going towards the epidemic belt. Like when you are moving out of a mobile network range area, they'll send you a message. Same way, it will send a message. So the seemingly perfect idea has its own set of challenges. One is it has to be adequately outreached by the masses, otherwise there's no use for this technology. Two, there is poor uptake of electronic records by doctors in India because the doctors do not want electronic records, because then they have to spend money on buying computers and all. And then three is that we don't have interconnectivity in the devices, and then four, and last users are not involved in the health information system design and implementation strategies. So the law means the customers only will be able to say what and all improvements the product needs, how the product is good and all. But uh, cu- the customers here, that is the Indian public, are not involved in the system designing and implementation strategies. Then the risk covers instructions means there are institutions that do not want to means risk their information on the computers and all, and also outdated laws have slowed down the digital innovation in healthcare, because you have to means the laws has means all the digital innovation has to abide by the laws. So some of the challenges can be solved like we can encourage the doctors to adopt the EMRs, electronic medical reports, and then it also uh, means to encourage them you need them to be easy to access and affordable, and they need to be affordable. Then the system should ensure that it collects only the data that is needed and does not overload the system with a lot of data. Uh, Many people have suffered from physician burnout in the US because of this, and then and they have to ensure and this ensure a participative approach whether all the stakeholders are involved in the planning of design and implementation. This will help in getting best feedback from them. And proper funding, research, and analysis needs to be done regularly so that interoperability is achieved, and this contributes to efficiency. Like, for example, if there is if the phones are the systems and devices are not interoperable, then there's a disadvantage. Like, for example, there in a device and you cannot transfer the data to the system, uh, and the device is not. And the device is means very large to that is very large and you can't bring it to this hospital to that hospital. Something is some problems occurring. Then then the doctor say to do a test again in the hospital. This will waste a lot of time and money and futile resources, and this will lead to the same result, which means that there won't be any difference of means we will just be wasting double the amount of money in it. So instead of that, you can just increase the efficacy and reduce duplicity of that thing of that data. And encouraging the investments and promoting the API based ecosystem is incorporates the interoperability and standardization at the best. And then you have to means the national e-health authority has to pay special attention that the technology matches with the code and conduct of the constitution. Means all the rules and laws of the constitution. The technology abides by the rules and laws of constitution. For example, means the constitution allows right to information. So according to that, you have to be some people have the right to get information of their medical report. So this technology has to abide by that. Or right to privacy. Means these people can means these people can hide their medical records from other relatives or so. Uh, so the technology has to be designed in that way. If the technology does not contain that does not contain that applications means advanced does not contain that specification or feature, then the technology is illegal in India because it does not abide by the rules of constitution and will be useless, and ultimately lot of money will be wasted. And even though this and even though means the national health authority will provide the patients data ownership rights, we don't know that we don't know whether they have the data ownership rights, but suppose it's a problem between two people over the data ownership rights, and then you can like make a ownership in terms of control and access. Means like this person owns this data, and that person owns that data. Like you take a land, means you take the land estates, land areas and all. So if a person buys one land area, then he only can own and control that area. Another person buys another area, he can own and control that other area. Like that, means data can be used as like resources, not resources, products. And the problem of outreach will have to be assisted with the help of means addressed with the help of large scale initiatives. Large scale initiatives in the sense large programs that promote this, and government schemes like NHPS, that is National Health Protection Scheme, has the power to reach tens of millions of people, and hence an API based architecture can be integrated with the NHPS. And then the Aadhaar series, the Aadhaar number can be used in this technology, so that if you enter Aadhaar number, then this person can access it. Somehow this has to be implemented as a unique identification for that medical record. After this, you have to after this you can come to a conclusion that then means the National E-Health Authority has to take care of many things, but still, if it takes care of it in the developing stage, and in the developed stage, it can easily manage all the things, and no problem will occur. And one important thing is it has to make the technology according to the it's abiding the laws of the constitution, because if it does not abide by the laws of the constitution, then the technology will be completely useless, and the and this will cause massive protest and outbreak, and this will ultimately lead to waste of lot of time and futile work. Thank you and have a nice day.